Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. Now, I see a lot of people that do some sort of exercise, they just love it, and they actually train and compete in it. Runners, obviously, are the biggest example, but I see people that do CrossFit and Spartan races, and they do, all sorts of athletic endeavors, and it could be sports as well, and it means so much to them, but they develop a pain that really limits their ability to do it, and they want to know, should I get it checked out? And they don't necessarily want surgery, but they don't like the idea of potentially needing an MRI, and so they really have sort of a hesitation about going to get it checked out. And so I'm going to address that sort of difficulty, dilemma for athletes in today's Ask Dr. Geyer video, specifically with a runner. Becky asks, I'm pretty sure I have a stress fracture in my heel. The podiatrist said I don't need an x-ray. She'd be able to tell because when she pressed there, I'd have pain. I ran a half marathon, full marathon, and a 50K last month when I get a sharp pain on the outer side of my foot below my ankle bone. Do you have any suggestions? Well, it's a terrific question. First of all, you can develop a stress fracture of your heel. The bone is called your calcaneus, and it happens especially in women, later 40s, 50s, 60s, where the bone may not be as dense, but you see it in people that do a lot of repetitive impact. And I would argue a marathon and a 50K clearly is a lot of impact. And just like any stress fracture, what can happen is it's basically a problem where it's too much stress over too little time to heal. They're microscopic stresses, but they build up over time. The body doesn't have enough time to heal, and so basically you push through pain, and that pain eventually can turn into a stress fracture. Now, the podiatrist is right. You don't always need x-rays or an MRI to diagnose a stress fracture of that heel bone, the calcaneus. You can basically, in physical exam, an orthopedic surgeon can squeeze the sides of the bone together, and if that causes pain, pretty good test for a stress fracture of the calcaneus. And x-rays can be negative within the first 6 weeks or so for a stress fracture, like stress fractures of other bones, so that can be an important thing to note. A lot of times we won't get an MRI if that squeeze test of that calcaneus is negative, because what are you going to do if somebody hurts? Even if, rather than spending all that money on the MRI, if they hurt, you're still going to back them off of running, maybe put them in a boot, and you try to do things to get it to heal, so maybe you don't get the MRI. It's not that the MRI is necessarily a bad thing, but they're expensive, and potentially you would treat the pain anyway. Now, getting back to the question of what should I do? I think anytime you've got some injury, some pain that's limiting your ability to do what you want to do, get it checked out. Obviously, if it's a stress fracture, maybe you catch it early before it becomes a bigger problem. But if it's not something worrisome, then you take some simple treatments that are recommended by the surgeon or the doctor, and you get back to activities knowing you're not doing any more harm to it. Now, have you suffered a stress fracture of your foot, and what did you do about it? Did you get an MRI? Did it cost you to miss a lot of time? I'd love to hear your thoughts. So below this video, share your experiences. I'd love to hear how you dealt with it. Did you go get it checked out? Did it keep you from races or whatever it is you like to do? And if you know somebody that's dealing with a stress fracture of the foot or the ankle, or just a pain and they don't know what to do with it, please share this video with them. I hope it can be helpful in some way. Now, if you like videos like this and you want more information on injuries and injury treatments and injury prevention in sports and exercise, subscribe to my video channel. I record a couple of these videos every single week, and they'll get delivered directly to you. And last, I record and be it audio or video, or I write so much content on ways to stay healthy and perform your best, whatever sport or exercise you like to play, and I only share them by email. So go to my website, drdavidgeyer.com, enter your name, enter your email address, and I'll deliver those directly to you. Thank you so much for watching. If you have other questions you'd like me to answer in an Ask Dr. Geyer video, send those my way, and I look forward to seeing you right here next time.